Good morning, everyone, and welcome to this session of the HFA studio by ESC TV. This session called Heart Failure Matter in Practice, the listening to the patient voice, live at the HFA Congress in Barcelona. My name is Michela Barisone from Italy. As a background in cardiovascular nursing, currently I work as a clinical outcome and innovation expert in Milan in a Humanitas Research Hospital and serve as a secretary tutorial for the association ACNAP, Cardiovascular Nursing and Allied Profession. Today, the topic will be discussed with the guest is living with an ICD from the patient perspective. It's a very great pleasure for me to introduce the guest for today, Francesca. Very welcome.
Thank you, and thanks
Francesca,
for having me
welcome.
here. So
Will
my
you
name is
present yourself?
Thank you. So my name is Francesca, and I am 34. I was diagnosed with hypertrophic cardiomyopathy when I was 24, so 10 years ago-ish. I was born with a heart murmur, and so my parents were suggested to take me to checks every 5 years. And during one of those checks, they understood I had something wrong in my heart. So the diagnosis was very early done. I was lucky for that. And after a few years, they noticed that the fibrosis was a bit more than the last MRI. And so they decided to implant a defibrillator on me, which saved my life 2 years after the operation.
Okay. Francesca, very welcome. When you discuss with you for this interview, I know you have created a social media as active profile, and I ask my first question for you. Could you tell me where the idea is to create a social media profile in this topic? What is the main reason, the motivation for you open this profile?
Yeah, sure. So after the operation, I went home and I was looking for someone else dealing with the same things I was. And I couldn't find anything on the social media on Google. And so I decided to open my own Instagram page where I share my journey to turn fear into connection and to help others feel not alone, supported, and yes, to make other patients and their families understand that we are not alone in the journey.
Okay, it's a very incredible experience. It's most important to share your experience with the other patients and their family or caregiver. It's important things. The second question, what are the most common questions you receive from your social media follower? What is the main question, curiosity, or fear you receive through your social media profile?
Well, most of the questions are about daily life activities. So people wonder whether with a defibrillator they will be able to do sport, to travel, to drive, to work. They ask about sexual activity as well. They ask whether people around them will be shocked if they do get a shock. Like
Yeah.
every kind of daily life questions that
Yeah,
you
yeah.
may have.
Is the most important, especially I think after the discharge, living with ICD after discharge, the intervention or recovery. Clinician and role and allied professional in general play a crucial role in care pathway from communicating the diagnosis and also to recommend the ICD implantation. Based on your experience, is there anything you would suggest the advice or information to best support patient and their family and caregivers?
Well, I was given technical indications. I was told that everything was going to be back as to normal, but I think I missed. I think they should suggest people who go through implant to have physiotherapy, rehabilitation after the operation. I think they should tell patients that there are big communities, patient associations, because you need to have someone to share your experience with. Mm, and yeah, you need to know what happens next. You need to be educated, because if you are educated, you understand your body and you learn to live better with it, even with a device inside you.
Yes, yes, Francesca. You previously mentioned one important thing about the need of patient to share your experience with other patients and family. Several studies highlight the relevance of this topic, the sharing the information. For your experience, what is the most important to acquire from clinician or nurse during the recovery and after their discharge for the patients?
I think we should tell them that it's not it's not like something which happened to them. Mm. Well, I think we should tell them that there are other people dealing with the same thing, that they can find, yes, these associations, that they can talk to someone, they can have psychological support,
Exactly.
they can just yeah, see that they are not alone.
Yeah, yeah, yeah. I agree.
And if you share your story with others, you also understand how others live. And if you see that you can still have a normal life, an happy life, you are reassured, I think.
Yeah. Thank you, Francesca. My last question for you is thinking of people who are due to undergo SICD or those who have just had one and are still living with doubts and uncertain, what do you like to say to them based on your own experience?
Well, I want to tell them that when I was advised to implant a defibrillator, I thought it was going to be a parachute, that I would have never needed it. Instead, it saved my life. Apart from that, it gives me the opportunity to do more things I couldn't do if I didn't have it on, like skiing. I wasn't allowed to ski. Now that I have a defibrillator, my clinicians feel more safe and they told me I can go. So I think it should be seen as an ally and not an enemy. It's therapy. Sometimes you are scared to accept you need a defibrillator because it makes you understand you have something serious. You have a heart disease. But that's not an enemy, it's a friend.
Yeah. I I try to I find through your social media profile you are called the name your ICD.
Mm.
You want to share your
Well, it's called Francesca Living with the SICD. And another thing I think clinicians should keep in mind, that we are patients, but we need not to forget that we are people first. So we need to focus on how to deal with people and not to see them just as patients, because that's not the only
Yes.
thing we are.
Yeah. And another important thing you are currently I'd like is the security of the device in your life. You do want to share one thing for the patients about the security, the implantation.
You mean that it makes me feel
Yeah, yeah,
secure? Yes, because it's like something that would help me anywhere.
yes,
And when we were talking about physiotherapy, rehabilitation, psychological support, I think we should also focus on data sharing with colleagues, respecting privacy, but sharing data so they can help each other to help the patient, the person that
yeah,
needs
in your life.
the help.
Yes. Thank you so much,
Thank
Francesca,
you.
for your sharing your experience with us. I think it's very important to acquire this information to improve the quality of care for your patients and support the family. You mentioned psychological support is very important for this pathway of care, but it's very useful for the clinician, for nursing and the life profession to implement the quality of care in your center. Thank you so much for joining us, Francesca,
Thank you.
for this session, and enjoy the Congress at HFA Congress in Barcelona.
Thank you.